Welcome to Consulteer Inc. and Interlink IQ. To conduct a document review utilizing the staff engaged in food handling and processing operation program under the SQF Module 11.4.1, first check if the document title matches the uploaded file name on the dashboard. In this instance, we do have the same titles as the staff engaged in food handling and processing operation program. Next, both must have the same document code. For this example, we do have 11.4.1P0. Since this is a template, we indicate the PCQI as the account initials. However, we can customize the code based on the company's initials. For the page number, we use the page XFY format. Ensure that it reflects the current page position and the total page number of the document. Then insert the company logo here, together with the company name, the company address, and enter the designated department. For the originated by section, it can be the food safety, quality assurance, or the quality control personnel of the company. The originator ensures the implementation of the quality management and document control system. Enter the name of the originator, affix the signature, input the position title, and the date originated. For the reviewed by section, it can be the personnel assigned in the quality management department who reviews the drafted document or its revision for accuracy and implementation. Enter the name of the reviewer, affix the signature, input the position title, and the date reviewed. For the approved by section, it must be the person in the C-level management who has approval authority. Enter the name of the approver, affix the signature, input the position title, and the date approved. The revision date is the same as the date originated or drafted by the author. For the effective date, it is the date the document was signed and approved. The publication date is when the document is published for distribution and initiated personnel training. The implementation date is when the document is distributed and personnel training is completed. For the supersedes, put original for the initial issuance of the document. For any revisions, reflect the initial revision date before the current revision. Please be reminded that this section must be properly filled out to be compliant. Now we will focus on the components of the program. First is purpose. The purpose is the implementation of any certification standard or compliance with a regulatory requirement. For this program, it is for implementation with the SQF Module 2 Edition 9 for food manufacturing under Clause 11.4.1. First, to implement SQF 11.4.1.1, all personnel engaged in any food handling, preparation, or processing operations shall ensure that products and materials are handled and stored in such a way as to prevent damage or product contamination. They shall comply with the following processing practices. 1. Personnel entry to processing areas shall be through the personnel access doors only. All doors are to be kept closed. Doors shall not be opened for extended periods when access is required for waste removal or receiving of product or ingredient or packaging. 3. Packaging, product, and ingredients shall be kept in appropriate containers as required and off the floor. 4. Waste shall be contained in the bins identified for this purpose and removed from the processing area on a regular basis and not left to accumulate. And 5. All washdown and compressed air hoses shall be stored on hose racks after use and not left on the floor. Second, to implement SQF 11.4.1.2, personnel working in or visiting food handling or processing operations shall ensure that 1. Staff shall not eat or taste any product being processed in the food handling or contact zones except as noted in Element 11.4.1.4, SQF Food Safety Code Food Manufacturing Edition 9, 68 Part B, the SQF Food Safety Code Food Manufacturing, Module 11. 2. The wearing of false fingernails, false eyelashes, eyelash extensions, long nails, or fingernail polish is not permitted when handling exposed food. 3. Hair restraints and beard coverts, where applicable, shall be used in areas where product is exposed. Fourth, smoking, chewing, eating, or spitting is not permitted in areas where product is produced, stored, or otherwise exposed. And 5. Drinking water is permissible only under conditions that prevent contamination or other food safety risks from occurring. Drinking water containers in production and storage areas shall be stored in clear, covered containers and in designated areas away from raw materials, packaging, tools, or equipment storage. Third, to implement SQF 11.4.1.3, the flow of personnel in food processing and handling areas shall be managed such that the potential for contamination is minimized. And fourth, to implement SQF 11.4.1.4, in circumstances where it is necessary to undertake sensory evaluations in a food handling or contact zone, the site shall implement controls and procedures to ensure food safety is not compromised. Sensory evaluations are conducted by authorized personnel only. A high standard of personal hygiene is practiced by personnel conducting sensory evaluations. Sensory evaluations are conducted in areas equipped for the purpose. And equipment used for sensory evaluations is sanitized, maintained, and stored separately from processing equipment. The second component of the program is scope. The scope of the program is based on the purpose and serves as a guide in defining and describing the layout of the procedure. It includes product handling practices, sanitary operational practices, access points, operational areas, and waste containers. Third is policy. The policies are the rules set by the company as their implementation guide. Employees must follow the company's good hygiene practices in any food handling, preparation, or processing operations to ensure that products and materials are handled and stored in such a way as to prevent damage or product contamination, which you may refer to Food Safety Policy Statement and to Food Safety Culture. Fourth is procedure. The procedure is the step-by-step process and the actual implementation of the policy. First, under procedure, is product handling practices. Proper product handling practices combined with sanitary conditions result in reduced risk of product contamination and fewer product returns or complaints. Second, under procedure, is sanitary operational practices or SOP. While management has overall responsibility for ensuring that sanitary operational practices are adopted and for establishing hygiene procedures, line operators and supervisors have a responsibility for ensuring these procedures are carried out properly and effectively. Management must develop a list of good hygiene practices of do's and don'ts. This list must be consistent with Sections 11.3 and 11.4 of the SQF Code. This will be part of the documented procedures and work instructions. All staff, contractors, and visitors must be made aware of these requirements before entering the site, which may refer to Personal Hygiene Policy, to COVID-19 Program and Infectious Disease Program, and to Visitors Program. Third, under procedure, is access points. The site shall have designated access points for personnel to enter and exit. Access points are defined as back doors, pedestrian doors, office doors, and any door that enters into the site from the outside. Doors that are open for ventilation must be screened. Next is operational areas. All operational areas must have areas for employees to be able to wash their hands upon entry into such areas. Where repack or recoup product handling areas are not in enclosed rooms, then personnel access requirements are applicable to the buildings in general, which you may refer to hand washing program. Next is waste containers. And lastly, under procedure, appropriate containers for waste storage are containers that are considered easily cleanable, properly labeled, not absorbable, and designed for the purpose. No packaging container is to be used for the storage of waste or scrap. Waste containers are to be clearly labeled or designated as waste in languages relevant to the employee workforce. See also 11.8 for waste disposal requirements, which you may refer to Waste Disposal Program. The fifth component of the program is responsibility. The responsibility of the person is indicated. It covers what to perform to comply with the procedure or the policy. The senior management is the responsible to ensure that food safety policy and procedures of the company are established and maintained to adhere safe quality food. The food safety team is the responsible to ensuring all policies and procedures for proper handling, preparation, and processing are implemented and trained by all employees. And the employees is the responsible to follow all the implementing policies and procedures. Sixth is corrective action. The corrective action is the process of taking appropriate steps to eliminate causes of nonconformities or other undesirable situations. In the event of noncompliance and protocol deviations, train all personnel on this policy and reference SSOPs. Noncompliance will require retraining or performance evaluation of the employee, and issuance of corrective and preventive action report. Seventh is review quality. The review section serves as guidelines for conducting the annual or periodic review. Good hygiene practices have been developed. Staff are aware of the company's good hygiene practices. Staff adhere to the company's good hygiene practices. All exterior doors have protective controls in place. Hand wash stations are available at designated access points. Employees, contractors, and visitors wash their hands at designated access points. Employees, contractors, and visitors follow hygiene protocols. Employees are wearing hairnets in the designated areas. Products or materials are stored in appropriate containers and not on the floor. Waste containers are properly identified, and waste is not left to accumulate in waste containers and is removed at appropriate intervals. Eighth is reference documents. The reference documents are the set of documents used to implement and monitor a program, policy, or procedure. It includes the Food Safety Policy Statement, the Food Safety Culture, Personnel Hygiene Policy, COVID-19 Program, Infectious Disease Program, Hand Washing Program, the Visitors Program, Waste Disposal Program, and Corrective and Preventive Action. Ninth is references. The reference section is composed of guides utilized to implement the program. Examples are the Certification Guide, regulations, and other widely accepted scientific journals, research, and the like. With a standard format citation, which can be based on either MLA, APA, or Chicago style, and update the access date. Lastly, history. The history section is where we can update the program if there are any changes or revisions made in the document. If there is a revision, enter the revision number, followed by the revision date, the description of the change made, then the name of the author or the originator, and the title or department of the author or the originator. Thank you for participating in this document review. Content presented are for training purposes only and are based on the interpretation of standards and best practices and must be customized for your intended use. To fully customize your programs, policies, procedures, forms for records, and lessons for training, you may contact Interlink IQ or Consultier Inc. at services@interlinkiq.com or simply call 202-982-3002. For free access, visit interlinkiq.com.